Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host Gurdeep Singh Sandhu, homeopathic consultant, and I'm here at 9701 Sarah and Court, Dublin, California 94568. My phone number is 408-687-1899 and email address homeomedicine HOMEOMEDICINE at yahoo.com. So, anytime when you are suffering from any disease at any age and you are tired of any treatment, please call me for your second opinion of your disease and also of the treatments. I can guide you according to the nature's process, how the nature was curing before the medical science. When there was no medical science, at that time, people were suffering from diseases, and the nature was also curing the persons at that time as well. That is why we are surviving here. Otherwise, the life would have finished in its beginning, because since then, diseases are following us, though they were simple diseases, just like seasonal diseases, winter diseases, summer diseases, and even you can say this rainy season diseases. And but at that time, there was no medical science, but even then, all these diseases were automatically covered. Automatically means the nature has its own process to save the life. And in that way, the life was saved, and it is the proof that we exist. Otherwise, it would have finished in the early stage of the life, early beginning of the lives. But now we are here. It means the life was stronger than the diseases, the life was stronger than the hurdles in its pathway. So that was the nature's work. Nature was doing it by itself, by one or the other means. And now, as the man advances and has started using its own skills, its own intelligence, and sometimes that intelligence does not match with the natural processes. And if it does not match with the natural processes, at that time we do something against the natures, and does not mean that we cure. We suppress some symptoms of the disease for a short periods, but we are complicating the process of the nature and complicating the process, the way of the life. In this way, since then, the life has become more complicated. Diseases are become more difficult to be cured because we have added our own intelligence, and that was sometimes, not sometimes, but you can say the most of the times it was against it was against the nature's rules, and that is why diseases are multiplying more than one. There are many more complications in the diseases, and in this way the life has become more complicated. But even then, we are surviving. Though there are many more hurdles in the normal go of life, and there are many more diseases complicated day by day because of our own intelligence, which is against the nature's rule, and we are adopting it because we are running in a world which needs everything to be done fast and fast. And in this process, the nature does not match. Nature has its own process to cure the this body, because all the tissues in this body, there are different kind of tissues. Body is made up of different kind of tissues, cells, and they have their different period of repairs. Just like if you have to go somewhere and there is a particular type of difference, that this is how many miles from here, and what route you adopt, what way you adopt, it depends upon that how much time it will take. You can go by walking, you can go by cycles, you can go by motorcycle, you can go by cars, by air traffic. It depends upon the distance. In this way, it may be little faster, it may be faster than the normal processes, but But ultimately, it takes time. Ultimately, it takes times. But time to time, man is of the mentality that I want to cut short the periods for every processes, for everything which is happening with this body as a disease. We want to cut it short and we want to cure it immediately. And that is why time to time we are adopting some type of means which are not suitable according to the nature's process, which are not the right according to the nature's process. And in this way, in spite of curing, we are complicating the diseases, and we have complicated the diseases. That's why nowadays there are names of the diseases, and we are unable to. First of all, what was the disease? First of all, the disease was disease, not easy, and not easy it was expressed by some of the symptoms. But nowadays, name of the diseases are so wide, and a list of the diseases had increased day to day, and dictionaries are full of the name of the diseases, because day to day, every day, we are complicating the process of cure. We are complicating the way of nature to cure the diseases, and that is why there are some of the diseases very dreadful. Yes, some of the diseases are naturally occurring, just like the accidents, fractures, external injuries, and all those things that may happen in the normal go of life. But even then, the process of these injuries to be cured by the nature, it's a scientific process and scientific approach. And every tissue, whatever is involved in the injury, has its time period, that how much time it will take to cure, how much time it will take to repair. So all that depends upon person to person, you can say. But we are of the nature that we want to cure it as fast as we can, and we are adopting some type of means to cure it fast and fast, which are not suitable to the nature's process. And when it is not according to the nature's process and against the natural rule, then it complicates the diseases. And that is why most of the patients with the similar type of symptoms are going to the doctors time and again. Time and again, they are going to the doctors for the similar type of symptoms, because they are reappearing. They are reappearing once they are suppressed, and nature has to suffer one time from the disease process, on the other at the same time from the medicinal process what we are adopting, just to cure it, just to suppress it immediately, not curing. And ultimately, when the time period of that medicine is over, ultimately this same symptoms, same sickness comes again, and for the same we go to the doctors again, again, again. So this is not according to the nature's process. For that one, we must understand systematically that how the cure takes place in this body, how the body becomes sick. So I just want to give you a basic idea about this one. That this body is structured and made up of cells, and each and every cell of the body has a unique set of its organelles inside the cell. Just like every cell has a nucleus, every cell has Golgi body, every cell has mitochondria, every cell has many other organelles, some of them are multiple. And in this way, all the organelles inside has their own specific work, own specific duty to perform, so that a normal life be created. But if due to external reasons, environmental reasons, due to food materials we give it to this body, ultimately sometimes it happens. It happens that the recovery is stopped. Recovery, or the work of the organelles inside the cells, is disturbed. They cannot perform their normal duties. And when they cannot perform their normal duties, it means when I'm talking about cell, does not mean that I'm talking about one cell. I'm talking about the trillion cells of the body, because this system, whole system is attached to each other internally, and power generated by each and every cell of the body ultimately, when unites, it forms a new life, it forms a healthy life. And when any of the organelles in trillions of cells, any of the organelle is not working normally, we feel its abnormality by the sensations and feelings of the sick persons. For example, if mitochondria is not working normally, which the purpose of this mitochondria in the cell is to produce energy, it means if mitochondria are not working throughout the body, it is generalized things, and a person will be weak, lethargic, and all that thing will be affecting our normal go of life. It means the normal total energy will be affected, and that is shown outwardly. Internally there is damage, but externally, without using any techniques to find it out, still there are, in preliminary, there are some signs which we can assume outwardly, which we can see outwardly, and can imagine from the outwardly signs that this person is suffering from this and this problems, that this kind of damages or changes has occurred inside the cell. That is why this person is having this kind of symptoms. And in this way, we have started a process that when a cell is sick, or any organelles inside the cell, first of all, if any organelles inside the cell is not working normally, it means the cell is sick. When the cell is sick, it's transmitting and cooperating with all other cells of the body throughout the body, and ultimately the energy generated by the whole body will not be able to create a normal life. And if it's not able to create a normal life, it means he's sick. So when there are nine systems working inside the body, and nine systems have, every system has various organs working for that system to complete, just like to complete the respiratory system. Complete respiratory system, we have nose, we have larynx, we have bronchus, we have lungs, and this completes the whole system. But if somewhere there is a defect in this route from nose to the lungs, our respiratory system will be defective, and we can see its sign outwardly. And suppose if liver is not functioning normally, if liver is not functioning normally, we have many more signs outwardly. We can assume from the outwardly visiting that person that he may have some problem in the livers. And yellow eyes, yellow face, urine yellow, skin yellow, all these things are indicative that he is having problem inside, and that problem is in the liver side. And because these are the symptoms indicative of the liver problems, in this way, the similarly, if a person is having any problem in its heart, and it will produce some of the abnormalities which will be visualized outwardly, and we can see that this kind of signs, we see that there is a swelling in the ankle, there is a swelling in the face, breathlessness, weakness when he walks about, palpitations, low blood pressure or high blood pressure. What are all these are symptoms? I'm just telling in general. We will describe one by one each and every organ when they fall sick, what are the symptoms. But in general, I'm giving you an idea. When any of the systems, when any of the organ of any system is not working normally, means the organelles in this, because every organ is formed by cell. Cells are forming the tissues. tissues are forming the organ, and organs are forming a system. In this way, we are going to the deepest, the single unit of forming this system is the cell. And I'm talking about that cell, that if the components of the cell, if the organelles which are working inside the cell, any of the organelle, if it's not normal, it shows its abnormality, and which is visualized, which is presumed by sign and symptoms outwardly on the body, because it's not only the one cell, it may be the trillion cells, the million cells of this body. They are having that kind of defect, and that defect has, except only the local injury. Suppose if someone has an accident and has injury on the legs, so that is localized. But when it goes to the repair, it is generalized. Every disease is cured by a generalized process, and there is a scientific process how the cells are repaired. We will go to that one later on in the pathology, that how it repairs occurs. But to fall sick, it may be sudden injury, but it may be a gradual damages in the system or in the organs, because of bad environment, because of bad foods, and all because of bad habits and living habits, and all these things can produce ultimately some damages in the cells and some damages in a particular type of organelles in the cells. And those are indicating himself by the sign and symptoms outward on the body. And if we recognize all those signs systematically, we can easily go deep to the organs to find out that which one organ is damaged. And in these series of lectures, I'm just giving an idea to you, that if a brain has any problem, but because we have started from the brain, we will go to the organs of the chest, we will go to the organs of the abdomen, we will go to the organs of the pelvic areas, and one by one we will discuss each and every organ if ever they fall sick. When I'm talking about the system, or when I'm talking about the organs, and when I'm talking about this, I'm talking about the cells they are composed of. Any organ, it is composed of the tissues. Any tissue is composed of the cells. Mean the minimum single unit is a cell. So whenever I'm talking about man is sick means it's nine systems. Any of the system is not working normally. And when I'm saying any system is not working normally, it means the organ composing that systems are not normal. When I saying this organs composing this system are not normal, means I am saying the tissues inside any organs are not working normally. And when I'm saying the tissues in the organs are not working normally, means the cells inside that organs are defective and they are unable to perform their normal duties. So in this way, one by one, we will be discussing each organs if they fall sick inside the body, because nowadays there are many more technological devices we have: X-ray, ECG, scan, many other things to find out what's going on inside, because these are our internal eyes. But I'm talking about the external eyes. What by our external eyes we see sign and symptoms outwardly when any organ inside the body is damaged. So one by one, systematically, we have started this thing, that if brain is sick, though when I'm saying the brain, do not become confused that it's one organ. No, there are many more organs inside the brain: cerebrum, cerebellum, mons, medulla oblongata, pons. Many organs are inside that. But when collectively, overall, I am talking about the brain, and everybody consider whatever is inside the skull, it's a brain. So let's see in that way. Ultimately, I will discuss each and every organ of the brain I have just recognized, I have just told you about the cerebrum, cerebellum, os, medulla oblongata. I will tell you the sign and symptoms of each organs later on. But collectively, collectively, if there is any problem inside the brain, means any organ is sick, and that is causing some type of problems, and person is sick, then what we will assume outside of the body? Immediately seeing a sick person who's having problems inside the brain, what we will assume? So that if you see this kind of patients, you can immediately refer him to the appropriate department to get easy and fast help. But if you do not recognize, you will go the general department of the hospital, then they will figure it out, and then they will transfer it to the other departments or the concerned departments after that. It may take a longer period. But I'm delivering these lectures to all the publics who is listening in English, Hindi, and Punjabi every day in one language. Just like we are delivering this lecture in English, it was already delivered in Hindi and Punjabi in previous days. So today we are delivering this lecture in English, that if any part of this body is falling sick inside, it is indicated outwardly by some signs that an internal organ, and particular what organ is affected. That is why these are the signs. They are proving that internal organ, and particular that organ, is affected, is sick. In this way, we have starting from the brain. And the brain as a whole, whatever is inside the skull, if we have any internal problem inside the brain, it is immediate. There are some of the signs immediate. Just for example, some of the signs are produced gradually. When the signs, symptoms which I am telling you now, if they are uh, coming up on the systems gradually and ultimately up to the maximum height, it indicates some type of growth inside the brain is developing gradually, and ultimately it is suppressing the function of various other organs and also of the nervous system. I told you many times that there are 12 pairs of cranial nerves, and all the 12 pairs of cranial nerves are controlling the whole body, sensation and function, both things. In this way, if there is a tumor, there is a growth inside any organs, ultimately it will take up the space of the other organs. It will take up the space of other organs, or you can say it will pressurize the other organs or squeeze them, because there is a outgrowth. There is a growth inside the organ. And ultimately, when the other organ are pressed because of the swelling or the development inside one organ, the other organ are bound to squeeze. And ultimately, if they are squeezed, their function will be involved. Function will be abnormal. And that will indicate by the sign and symptoms outwardly. So this is what in today's chapter I would like to tell you, that if there be a sudden problem, just like bleeding inside, just like if somebody hit the head and it's a hard hit in the head, bleeding inside, swelling inside, all these things, just like a person was having epilepsy. Since long he was having epilepsy, and ultimately he fell down during the attack, and he has head injury. And after that, after these kind of incidences which are occurring and causing the hit on the head, the symptoms outwardly we will see are closeness of the eyes. Eyelid are closed. He cannot open the eyes, and it is very difficult for him to open the eyes. Even you call him. Suppose when we call any persons, he see you, he turn towards you, and also he will open the eye and see you. But if there is an injury in the brain, then he may listen. We will come to later to this point. But the first thing I'm talking about the eyes, that you call him, he is unable to see you. He is unable to open the eyes widely to see you, because the controlling power of the lids, the nerves which are controlling the lid power, has been damaged, has been pressurized by any swelling, by any bleeding inside, and by any fluid secretions inside, whatever it is, it has damaged the power, so he cannot open the eyes. Dropping of lids, this is known as dropping of lids. That then, if suppose if you open the lids forcibly by your finger, and normally our eyes are sensitive to light, but when there is an injury in the brain and person has dropped lids, cannot open the eyes, and you open his lid by your fingers, and ultimately you put a torch light in the eyes, the pupils are insensitive to light. Insensitive to light means they do not respond to the lights. They do not respond to the light. This is the first and second symptoms of the eyes that you see when a person is having a problem in the brains and sudden problem in the brains. So in this way, second thing, pupils. You see, when you open the eye, there is a white area, and in between the white area, there is a black area, and that is known as pupil. And the people, the white area is known as conjunctiva, the black area is known as pupils. And this pupils inside there is a black small area which continuously uh, constricted and large means it's continuously in movement. Constriction, relaxation, contraction, relaxation, normally. And when a person is having injury on the brain, on the head, then this constriction or relaxation continuously stops, and this pupil is widely open. Pupils of the eye is widely open. So this is the indicator that some problem is inside the brain. Insensitivity from the light, even the pupils do not dilate. It's already dilated. It remains dilated, and it do not respond to the light. So again, I can repeat: dropping of lids, pupils do not respond to the light, pupils are dilated, and also there may be loss of vision. That vision may be partially, maybe if it's gradually appearing the things, if there is a gradually growth inside the brain, and gradually it is enlarging and ultimately putting pressure to the other organs inside the brain, he may have a vision loss, but which is gradually developing, gradually increasing. So gradually increasing vision in the eyes, indicative of that there is a some type of swelling, maybe tumor or whatever, which is causing pressure on a particular type of nerve, and that is why the vision, just like the optic nerve is responsible for the visions, and in this way we can assume easily that his vision is diminished. and it is increasing gradually and gradually. It means that swelling inside the brain is developing, is enlarging, and putting more and more and more pressure on the concerned nerve, which was supplying the vision. So, in this way, we can figure it out that a person is having injury or person is having damage inside the brain. There may be bleeding, there may be fluid extra draining from the vessels, all these other thing. Other thing, from the visualizing the face, you can see there are scratching markings, that's known as the battle signs. Scratching markings around the eyes. Around the eyes, there are scratch, just like you are fighting with anyone, and he is scratched your eyes here, face. In this way, scratch type of mark. It's not fighting, but it is all because of the internal damages inside the brain. This is also one of the sign of the damages in the brain, that there are scratch marks around the eyes. That's also indicative of the brain damages or brain problems inside that. Next thing, a person, whether or not he's having any previous seizures, just like if a person is having epilepsy, he may have previously under seizures, but if he's not having, even then, if a person is having sudden fall, sudden injury to the brain, and it is a severe injury to the brains, ultimately a person may have seizures. Seizures means sudden jerking and contractions of the muscles. Just like in epilepsy, you see that. Just like there are various types of convulsions, and it's not only because of the epilepsy, but there are various other kinds of convulsions from the other type of problems inside the brain. And if a person is having injury to the brain, he may have seizure, unconsciousness, sudden jerking of the muscles, and contraction, stiffness of the whole body. This is also an outwardly sign that you can assume that this person is having problem in the brain. Next thing, vomiting, and that is repeated vomiting. At the first instance, we can assume that vomiting may be because of some digestive problems. But a regular type of vomiting, sometimes it may happen that he, before the injury, he just have the food. And ultimately, in the vomiting, that may come up in few vomitings. But ultimately, this retching, this is known as retching. It's not simple. First of all, one thing is the nausea. Nausea, when you desire to vomit, but vomiting is not coming up. That is known as nausea. Then there is a vomiting. Vomiting means something is unwanted, has gone inside, and body wants to expel it out. And it is expelling it out backward. And it is nearby up to the stomach and it comes out. That is known as vomiting. But if there is nothing like that, but still he is pretending vomiting. When a person is pretending vomiting forcibly, that is known as retching. And when a person is having injury to the head, any problem in the brain, he may have retching type of vomitings even without any expulsion, without any food, without any froth, without any things. He is having retching type of conditions, that something will come up by the vomitings. So this is what normally we see in a patient if a patient is having any sudden problems into the head. Next, there are some signs just to indicate. whether a person has injury on the right side of the brain, or on the left side of the brain, or on the vertex of the brain. I have explained it previously in my previous lectures that the nature has a crosswise setup inside the brain, crosswise setup inside the brain, just like my fingers of the right hands are crossing to the fingers of the left hand, and the function of my right hand will control the left side, and the fingers of my left hand are crossing and passing over the right hand fingers, and it will control the right side of organs. So, in this way, if a person has fallen or has injury on the right side of the head, then the left side of organs, just like I can say the left eye, left nostril, left side of chest, and all left arm, all these things may show dysfunction, may show that they cannot work normally, abnormality, weakness, all these things. So, when you see a person has fallen and his right hand is not working, will indicate that he is having injury on his left side of head. And if right side is not working, it means he is having injury on the left side of his head. And again, after that, if a person is having injury on the vertex, top of the head, then ultimately his feet will be paralyzed. And if you feel the jerking sensations, plantar reflexes, you can say that in the feet. Sometimes you might have seen the doctors are having some pointed things and hammer and pointer things. They check the knee jerkings, and they hit with the hammers to check the knee jerkings, and also in the soles of your feet, they scratch with some pointed things to see the plantar reflexes, to find it out whether they are intact or not, whether the nerve supplying or controlling these areas is contract or not. But I told you, if a person is having injury on the vertex, then the lower portion of the body will be affected, and these plantar reflexes or the knee jerkings may lose. There will not be any jerking in the plantar reflexes, and also in the knee jerks, they will be absent. Second, if a person can walk, if a person is still semi conscious and you hold him to walk, he is having a loss of balance. He cannot control his body. It is indicative that the brain function is losing. Nerves which are controlling the balance of the body is not working normally. It means the brain is indicating outwardly that something with the nervous system has been pressed upon, and that they are not working normally. So the person cannot maintain his balance normally. Third thing, also the speech. A person, when has injury on the head, either side of the head, he may lose his speech. He cannot speak well, or even if he tries to speak, his voice you cannot understand, slurring voice, and you cannot understand what he is saying. He is trying to convey you, but you cannot understand his words. So, slurred speech, we can say that he is having. It's also indicative of any injury in the head. But if this thing is also coming gradually and gradually, gradually and gradually, his speech is lost. Gradually and gradually, his speech is lost. It is indicative of that he was having either hypertension or maybe ruptured blood vessels. Because of that, he may have a pressure on a particular type of glossopharyngeal nerve. That is why the tongue is not working. Or even there may not be hemorrhage, but having a tumor or swelling, anything inside the brain which is putting pressure on this nerve, and that is why his speech is lost. It's not necessary that his unconsciousness and everything. If things are happening gradually, if things are happening gradually, means the any swelling, any tumor is increasing gradually and gradually enlarging it, and as it enlarges, it put more and more pressure on the neighboring organs and neighboring nerves, and they cannot perform their normal functions. In this way, speech, hearing, vision, everything goes abnormal, or loss of, you can say, vision, loss of speech, loss of hearing. It happens gradually. Gradually, it was increased. And it will date back to the injury in the backside. And also, it's not only the date back the injury of the date injury. He may not have an injury. He may not have any fall or anything, any type of history. It may have that he is having blood pressure and any blood vessels was ruptured later on. He was having a stroke, and ultimately that blood oozed outside from the blood vessel, has a clot over there, and that clot is regularly putting pressure on any of the particular nerve, and its function is lost. Suppose if it's putting pressure on the tongue, on the glossopharyngeal nerve, it means speech is lost, losing. He cannot, gradually and gradually, he starts stammering. Gradually and gradually, you cannot understand what he's talking about. Gradually, if it's putting pressure on the optic nerve, it is vision is lost. Gradually and gradually, the loss of vision is increasing. In this way, loss of hearing, a person may have gradually and gradually increasing of hearing loss. He may have anything like this one, that there is a clot, there is a swelling, there is anything inside the brain which is putting pressure on the auditory nerve, and then the hearing is lost and increasing time to time. So these are the things which generally we assume that a person is having any problem in the brain. Unconsciousness is a common symptom when a person has injury, when a person has any problem in his head, maybe tumor, maybe bleeding, maybe outwardly, whatever it is inside the brain, person may be semi-conscious or maybe unconscious. And drowsiness, you talk to him, you call him, he said yes or no, but he cannot explain. Suppose if you call any person, when you call any person, call his name, then he will inquire about, yes, tell me what's going on. But a person having any problem in his brain, he has lost the power of reasoning. You call him, he will just simple answer, He will not explain because he has lost the power of reasoning to explain, to ask anything. So that is why it is a type of drowsiness, it's a type of inability for a particular type of controversy or questioning or reasoning, all that one. And sudden confusion. Sometimes there is a confusion. Everybody has confusion. Sometimes we are confused from many things. It's normal things. But if it happens and dates back to injury, or if it happens with the history of the hypertension, a person is having hypertension since long, then under those conditions, this confusion of mind may be related to that condition of the injury, or that condition of the blood pressure, or that condition of the apoplexy, means bleeding inside the brain later on, but it is recovered. In this way, a person may have confusion. But remember, this confusion is also a part of the aging factor. When a person becomes aged and had various other type of conditions, I will just tell you, then under those conditions he may have loss of common sense, or you can say this confusion. He's confused about even simple things. He know he's coming every day to home from outside, but he forgets the streets, where to go, where I am. So in this way, I will suggest to those who are having old peoples at their home, sometimes you are irritated. If they confuse for various other things, and you are irritated, I'm telling you all the times, you are always confused about this thing. It's not the time to be irritated on him. It is the time to console him. It's time to cooperate with him, because of the old age, his tissues, his the nerve system has become weak, retarded, you can say, and confusion is a part of that one. In this way, it is irreversible. And when it is reversible, we have other names. You can say the degenerating type of things. Gradually, every cell of our body goes in the deteriorating phase, or degenerative type of phase, or dysfunctioning phase, you can say, with the age factor. And when it's going to dysfunction, ultimately we say it is degenerative changes. So degenerating of brain cells is also represented by some of the diseases. You must know about that one. If you are having any old parents at your home, they may have some signs of Alzheimer's, they may have some signs of Parkinson disease. The Alzheimer's disease is a loss of memory, loss of thinking power, loss of controversy, conclusions, all these things. And mostly the old people after 75, 80, or even more than that age, if they are surviving, they are having these kind of signs more or less. It's not that all the persons are having Alzheimer. It's not that every person is having Parkinson disease. But if he is having, these kind of things are irreversible at this time, because even if we are competent as a medical man to recover those things, we are unable to, because the age of the person does not allow us to give sufficient time to cure. As I told you previously, every tissue has its repair time. That if this kind of tissue has been damaged, it will take, just like epithelial tissues. You have some problems inside your mouth soreness, everything. And we assume the epithelial cells are repaired. And epithelial cells are repaired within 3 to 7 days. It should be okay in the mouth. If it's not okay, then we have to find it out what are the hurdles behind that, and we can correct that. We can take care of that one. And it's a limited period we know about, that it will be recovered in this period. We know that just when there is a fracture of the bones, doctors say, okay, you need to be plastered for 6 weeks. Why they say 6 weeks? Because they know that the repair of the bone tissue will take about 6 weeks. And if it is not recovered within 6 weeks, it means something is complicating the things. Something is causing hurdles in the way of repair. And then we have to find it out. What are the hurdles in the normal time of repair? But when a person is having Alzheimer type of confusions, loss of thinking, and all these things, then you are unable to cure that, because the time which is required by the damages of this kind of tissues is more than that a person can survive. Even the nervous tissue inside the body, if the nervous tissues are damaged, they take about years to repair. And in this way, the old persons who are having Alzheimer's disease, confusion of mind, loss of memory, and loss of reasoning, all these things is we are unable to cure, because the repair time is more, and age is not providing us that much time. Plus, one other thing is, day to day, day to day, our metabolic rate is declining. I have explained many times that the metabolic rate is a term composed of two things: metabolic rate, anabolic rate, and catabolic rates. When we are quite young boy, our anabolic rate is high, and anabolic rate high means, suppose my in simple example, we are earning $5 and spending $3 or $2. $2 or $3 are savings. In this way, in the body, we are increasing the body in all directions, structure wise, thinking wise, functioning wise, everything is increasing. That is because of the anabolic rate is high. And the second part of the metabolic rate is the catabolic rate. So catabolic rate indicates the destruction, because there is a day-to-day repair, there is a day-to-day destruction. When this machinery, every even car who runs, you have day-to-day requirements of its repair. Time to time, you have to look it after. Time to time, you need service of your cars. The same way, this body has day-to-day repair, because as you can I can tell you, a cell of the body is you can say the age of a cell of the body is 120 days, just like blood cells. Blood cell, today, suppose a cell is formed today, they are formed in the long bones. Its age is 120 days. Means after that, in 120 days, there are phases of development of the cells. And ultimately, he will grow to young age, then ultimately it will decline, the function will be slow, and ultimately the new cells will come up and take its place. This is going on regularly. The same way as a whole, if you consider the body, it has a catabolic change. It has a catabolic change, and that catabolic change means the direction destruction. Just like the old car needs more repair, every day you go to the mechanic, every day it causes problem for you. The same way, the old age has declining phase of catabolic rate. Means every day the catabolic rate is increasing. Means every day you are earning by food, by air, and everything. You are trying to maintain this body. You are trying to maintain this body by food, by air, by environment, and everything. But ultimately, that earning is deficient as to your expenses in the old age. And then every day you are declining. Every day you are declining, and that declining cannot be compensated. Yes, we are having tonics, we have having prepared vitamins, we have many minerals prepared, and we are trying to give it to that. But ultimately, this is this body which has to assume and consume these vitamins, consume these minerals which are required to maintain balance of catabolic and anabolic change, body is weak. It cannot, even if you help somebody, and ultimately he is unable to take the help. He is unable to be improved by your help. So what will happen? Ultimately, he will decline. So this is the age I am talking about, that some of the diseases, head diseases, are immediate because of some immediate actions going on, reactions going on inside the brain. But some of the diseases which are known as degenerative changes, becoming old. In other words, you can say becoming old, and becoming old is irreversible. Though there are yogis and all other people, they are living more and they are maintaining their body, and maintaining their anabolic and catabolic rate means the maintaining their metabolism, and they survive more. Some of the genetic characters are this type, that people are surviving long time. It's their depends upon their genetic characters. But it's a natural thing after the a certain age for the general public. Not, I'm not talking about the yogis and are that those who are experimenting all these things. I'm talking about the general public. In general public, after the age of 75, 80, whatever, person has a degenerative changes in their cells, in their nervous systems, and they are producing the signs which are diagnosed as Alzheimer. And in this Alzheimer conditions, person has a loss of memory. Yeah, if you have old people, old parents at your home, try to understand. If you repeat things to your parents, to do this thing, to do this thing, and they forget it. And every day you repeat this thing, and you're, Dad, I'm telling you every day I'm telling you not to do this thing, not to do this thing, but you are doing this thing, or you are not doing this thing. I'm telling you, when you come inside home, please lock from inside, but you are not. I tell you, when you come inside, take off your shoe, but you do not. He is forgetting all these things. When he opened the tap and comes out from the restroom, come out from the from any sink, and you are irritated on your parents. You say, Dad, I told you, whenever you open the tap, please shut it down later on when you are done. But he forget everything. At that time, I am requesting, and I am telling all of you, those who are having old parents at their home, please not to irritate. Next day, you will be the old age, you will be in the same conditions, and try to understand they are passing through the degenerative changes of their nervous system. And it's a condition which is irreversible at this time. So, in this way, you have to cooperate your parents under these conditions, and be calm, be cooperative, and be helping, so that your parents be happy that you are proving a best daughter, a best son to us. People will see this, that how you are maintaining your old parents, and it will give you credit ultimately. The same thing is the Parkinson disease. The Parkinson is also a degenerative changes, and when you that was related to the memory, but this you can say the Parkinson is related to the functioning things. That was the memory, Alzheimer, and the functioning thing. Just suppose you are giving a cup of tea to your parents and putting it on the table, and you say, okay, Dad, take this cup of tea. And he tries to pick it, the cup of the tea, but ultimately it is jerked. Sudden jerk of the arm, and your cup of tea is wasted. And it happens not only one time, many times, and many things are dropped off. Many things are dropped off, and you are irritated. That every time you do not take care of. Please take care of all these things. You are wasting tea, you are wasting vegetables, you are wasting many other things, and be careful. But please understand, This is also a degenerative changes when you have a patients above 75 or 80 years of age. This is not their fault. This is the age factor. This is the disease we have now named it as Parkinson. That these are the tremors, jerkings, rigidity of muscles, slow movements, or in other words, I can explain that this is the incoordination of mind and body. Mind wants to pick up the cup of tea nicely as he was picking up previously, but body do not cooperate according to that. Body wants to cooperate, but is unable because of the involuntary jerking of the muscles, and that falls out. And the folly of this thing is that he is unable to control this thing. He do not want to spoil the things, but he is unable to do that because of the degenerative changes in the tissues in the brain. So we are talking about the brain diseases nowadays. So next, there is still what are the in general signs of the brain diseases, so that everybody should know all these signs. Suppose if you are recovered, if a adult person is having injury in the head, if an adult person is having any problem in the brain and has been treated even by the doctors say that he has been treated and now you have come home, but even then there are some of the signs he will be having. It's a similar type of condition, just like the old age, that you cannot help him, that he cannot help himself, but it happens. So I will describe those signs and symptoms later on, so that you should understand all these things, that this is not his fault. This is the fault of the damages occurred inside the brain with the nervous system. That is why a person is unable to do all these things. So, God bless you all. Today it was in English lecture. Tomorrow it will be in Punjabi lecture, and we will add something else. There are some questions arising from the public, so I will deal with those questions, and then we'll go after that one, how to manage all these things, what to do for all these things in tomorrow's lecture in Punjabi. So, God bless you all. This is Gurdeep Singh Sandhu, your homeopathy consultant, and my phone number is 408 687 1899. If ever, anytime you are suffering from any disease at any age and tired of any treatments and you are not improving and fed up, please call me for your second opinion of your disease and also of the treatments. I can guide you properly wherever you are. I can just give you the directions of the natures, what the nature wants in your disease, and what's the route of the cure in this case. And you have to follow that. If your treatment is passing through those channels, it's the right directions. It may take time, but if your treatment is not passing through those channels which are prescribed by the nature, you will not be cured. You may be improved temporarily, but ultimately you will not be cured. It will be complicating your health, and ultimately you will suffer with that one. So I can guide you with that one. Though, if ever you have any problems, please call 408 687 1899. God bless you all. We'll see you tomorrow. Thank you. Bye.